Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We've had so many calls relative to why do we call certain venues trauma centers, or is an emergency room a trauma unit, et cetera, et cetera. Well, as many of you mentioned, that not that I ever talk about myself, but you know that over the years, I was very involved with the creation of the definition for trauma centers in state law. So I guess a lot of that came from you, or some knowledge you had. But I figured I want to bring one of the real leaders in trauma services, and he is the medical director of the trauma unit, or he's the trauma general surgeon at Broward Health North, which is right there on Sample on I-95, Dr. Nichiporenko. Doctor, welcome.
Thank you.
They call you Dr. Nichi, but I don't particularly think that that's what I'm going to call you. So.
Well, you call me either way.
I'll call you either way, right? And the manager of Broward Health North, and I don't know what the manager does, but I'm going to tell you, I'm going to ask you, Jamie Rothenberg, RN, faithful nurse professional, married to a nurse, so I have to always make sure that I say a nurse professional. So Jamie, tell us about you.
I'm the trauma program manager at Broward Health North.
Right.
So I help manage the trauma services. I work hand in hand with Dr. Nichiporenko and oversee trauma services.
So, Dr. Nichiporenko, a lot of people don't know the difference between a beautifully staffed, high-tech emergency room and a trauma center. You want to tell them the difference?
Sure. So we are a trauma center. We've been a trauma center since 1992.
Correct.
And we're a level 2 trauma center designated by the state of Florida. And we have a capacity to provide high quality, good outcome, 24-hour service for our trauma patients. When people talk about trauma, they always think of trauma surgeons. They don't think of emergency room physicians. And the biggest difference is that we, as trauma surgeons, we're capable of not only making diagnosis, but also doing all necessary procedures in the operating room or in the emergency room for any traumatic injury that we encounter on a daily basis. As a matter of fact, our emergency room colleagues, they ask for our expertise when they treat trauma patients initially. So we are these people who are trained and capable of taking care of any trauma patient that comes to our hospital.
Let me just, and I know that you obviously both know this, but let me just let the people out there know that we have designated trauma centers in the state of Florida, and the reason why we have it under statutory law is because they're not really meant to be competitive hospital service units. People who are scored by the EMT paramedics out there in the field as trauma patients come from various trauma events, everything from blunt force to stabs to gunshots to drownings to car accidents to fires, and it's usually there are certain indices, certain indications, one of which happens to be blood loss, which is the one that's used very often, but they're scored relative to what the need is, and they will bypass certain hospitals to get to the trauma center because that's where the trauma team is. And a trauma center is affiliated with an educational institution. So we're a proud delegate that have been involved with you since 1992 at Broward Health North in the trauma center. So I'm leaving there as sort of the primer and explanation. So Jamie, tell me, I know you have incredible trauma professionals working there, but it isn't because they're good and well trained. It's because they also have a very specific role, not only under the law, but under their intellect. And I always say trauma surgeons, physicians, nurses, otherwise, they're the great advocates for life.
Mm-hmm. Yeah.
So talk to me.
Well, the nurses and the physicians, they have qualifications and they have to get certifications in order to provide care to trauma patients. It is a select few. Not every nurse in the ED is certified for trauma care. They have to get a certification, and then they have to have continuing education to keep up with whatever the latest education is in trauma care for patients. Same thing with the doctors. They have qualifications and certifications like ATLS that they have to have, and all of our emergency physicians have it as well, because they sometimes see traumas that come in initially as like a level 2 trauma, and they'll start triaging them and then call for expertise when needed.
So, Dr. Nichiporenko, talk to us.
Well, as you mentioned, in the state of Florida, we have different triage criteria for different trauma patients. There's level 1, level 2 for Broward County, specifically for us, depending on the severity of their injuries. And here in Broward County, we see all of them. We see all our trauma patients from the emergency room to from admission to disposition. We take care of all our trauma patients. Again, we work very closely with our EMS providers. We trying to establish very good relationship with our paramedics on the field, because they're our eyes and ears. And the information that we get from them is something that we use to get our hospital ready to accept and treat trauma patients. So based on their information on the field, they bring level 1, level 2 trauma patients or trauma codes. And to talk about what's the biggest difference is between the regular hospital and the trauma hospital is resources that are available to treat trauma patients. We have in-house trauma surgeon, 24 hours available, who's in the hospital waiting for a trauma patient to come in anytime during night or day. We have more than 19 subspecialists who are available to provide their expertise for any pathology that we can encounter when we treat trauma patients. We have a blood bank who, the blood bank has enormous amount of blood products that we use to utilize mass infusion protocol, which is a way of treating and stabilizing hemodynamically unstable patients suffering from the enormous blood loss from traumatic injuries. We have CAT scans available within 2-minute walking distance, where you can bring the patient and make the diagnosis immediately, right after their stabilization in the emergency room. We have operating rooms available 24/7 with the OR nursing staff with anesthesiologists in-house, where we can go straight to the operating room from the emergency room. We have, again, nursing staff that's trained to take care of trauma patients specifically, which is a totally different category than medical patient or even surgical patient. We have pharmacy dedicated to our needs for our trauma patients being treated with certain medications they would like to use. Same thing with the ICU care. We have ICU, trauma ICU that specifically designated to treat trauma patients.
You know, we have so many car crashes and motorcycle accidents and drownings that end up in, if it weren't for the trauma centers, many of these lives would not be saved or preserved for care.
Right.
Is that a good statement?
That's a great statement, and you're absolutely right. Going back to teaching our EMS providers, there is a great course called Motorcycle Safety Course, where we actually, as trauma surgeons, we go to the EMS stations. We teach paramedics what to use in their triage, in their evaluation of those patients to make a decision. Am I taking him to the trauma center or am I taking him to the regular hospital? And back to your statement, when they look at the anatomical criteria and physiological criteria, they look at the anatomical area of injury, or they look at the blood pressure, heart rate, respiratory rate, the mental status. That's what they use to decide, am I taking this to the nearest regular hospital or I'm taking it to the nearest trauma facility? And I think using this definition, this classification of trauma patients, because you're absolutely right, not every patient is going to be a trauma patient, but bringing the trauma patient to the right hospital is essential for a great survival and minimal mortality in trauma patients.
You know, just before the broadcast, we were talking about an ex-colleague of yours, but still participating here at Nova Southeast University, Dr. Murray Todd. Mm-hmm. And just to give you a sort of correlation to, I guess you could say, designation, you know, he fought for almost 12, 14 years, both locally and nationally, through the Congress of the United States and otherwise, and various societies to create the certification for stroke units. Again, a certified stroke center is not just any hospital you go to. You have to have the proper neurologic interventional team, and nursing team, et cetera, et cetera. So it's sort of, you know, it's very similar in a sense that there's definitional standards and anatomical standards which are adjudicated by these wonderful first responders, the EMT paramedics that are in contact with the people, for example, at the North Broward Trauma Center.
Right.
Correct?
Mm-hmm. Going along with that, it is a collaboration with EMS agencies and the hospital and then rehab, and we have social workers. But another big part of a trauma program is outreach and getting into the community to try to educate the population about how to prevent traumatic injuries, because some of these can be prevented. So we do spend a lot of time. We have a trauma outreach coordinator who will set up and go to health fairs, go to schools, go to churches, and just teach people and lecture about how to prevent a traumatic injury.
Well, it's and again, this is your show, but I give you let me get into it just a little bit. But you talk about prevention. Mm-hmm. You know, we have laws in the state of Florida that require fencing around pools with locks. I mean, drownings are we're number one in the nation in drownings of children under the age of 12. Dr. Nichiporenko, I know that also that there is a number of people that come out of Palm Beach County to get to your center.
Right. Well, it happens only if something occurs south of Hillsborough Boulevard.
I understand
because in the state of Florida, per statute,
it's
you
the mileage.
have to go to the nearest trauma facility within your trauma service area.
Right.
We have catchment areas.
Yeah,
So
right.
So our catchment area is anything north of Oakland Park to south of Hillsborough.
Right.
And then we have a great, collaborative network with Delray Medical Center. So we work together with trauma surgeons from Delray, Palm Beach County, and usually we're pretty good at at treating patients on the border of Palm Beach and Broward counties.
Tell me about renewing of equipment, ORs, things of that nature. I'm sure it must affect you and your trauma presentation at Broward Health North.
Right. So about 2 years ago, we were fortunate to have a brand new emergency room renovated, as well as we had additional 6 new operating rooms. And for a trauma center to be very efficient, you need to have very good network, very smooth process of going from the emergency room to the operating room in a very fast fashion. So in our hospital right now, our operating room is on the second floor. And when somebody needs to go to the operating room, there's an elevator designated only for that trip to the operating room, where you take your trauma patient from the trauma bay to the operating room for emergent surgical procedure. So all that was possible because we got this beautiful emergency room that has beautiful operating room on the second floor. So also the radiology equipment is also right next to the trauma rooms. Same as the ICU. If patient needs to go to the ICU, they go directly from the trauma bay to the ICU. And it's all possible because the modifications and the design that we asked for was built 2 years ago, and it was a big commitment from our Broward Health Administration, Broward Health District, to invest money into Broward Health North as a trauma center. And we were able to do a great job on providing great trauma care. And the testament to that is obviously how well we did with Parkland shooting.
Well, tell me about Code Green.
So, well, Code Green at our hospital is for mass casualty incident. And for the layperson to understand, it's basically when you have an incident where a lot of people have been hurt at once and they're going to maybe exhaust our resources. So for the hospital to be prepared, when we hear from EMS that it's a possible code green, or if they call it code green, we have to be ready and start pulling resources from other floors and start pulling, you know, whether it's x-ray techs, nurses, PCAs, basically all hands on deck in the ED so that we can handle what's coming to our hospital.
Tell people what ED is.
I'm sorry, emergency department.
Okay.
Yes. It's our trauma center, and the trauma center handles the MCI. But it can be anything. I think most people think of active shooters. It could be a train derailment. It could be a building on fire. It can be anything where you have a large number of people coming to our hospital. I think you had said earlier, depending on the hospital size, MCIs can be different for different hospitals.
Depending on the hospital, depending on the resources that the hospital has. For some hospitals, 3 patients is enough to be a mass casualty event. For bigger hospital like ours, we consider MCI anything that starts with 10 to 12 patients that can come simultaneously within a short period of time.
The kind of work that both of you are involved in is not only a blessing, but it's an advocacy that these people out here, whether it be, you know, the trauma units at Memorial Region or the trauma unit at Broward Health right on Andrews Avenue, or whether it be the trauma unit that's out on Broward Health North, what you're doing is not only presenting medical care, but you're presenting to the loved ones and to those who are around the opportunity for life. I want to thank you for those folks that are watching the program, because the service that you present is absolutely unbelievable.
It's a good team.
Right, it's a good team.
How do you feel about it? You're the RN nurse.
You know, I started off in med-surg, medical surgical floor, and I ended up in trauma years later, and I love trauma. I love to work in the emergency department. It was my fit for sure. And nurses will tell you kind of like when they find their home. But I like trauma. I like the outcomes of trauma. I mean, yes, there are some times where they don't make it, and that is very sad. But we always do everything we can to try to save someone's life.
I don't have to ask you, Dr. Nichiporenko, but I'm going to ask you.
Sure.
How do you feel
About doing trauma?
about doing the work that you're doing?
It's the most gratifying things ever, because you do help people in need, and it happens at midnight, it happens at 6 o'clock in the morning, it happens at 4 o'clock in the afternoon. What I learned about my job is that trauma is such an unfortunate event that it can happen to anybody, regardless of your social status, regarding of your gender, regarding of your age, and the amount of tragedy and happiness that involved in this traumatic event is so much that you truly understand the beauty of life and how much people should appreciate what they have. Because the hardest thing that for any doctor, for any trauma doctor to do is to tell a family member that a loved one lost his or her life, because trauma happens unexpectedly. There is no warning. And giving the bad news is the worst part about my job. But if I do have a chance to save someone's life, is the most gratifying thing that I can do on this, in this world. Yeah.
Well, it certainly makes me feel good, and I hope that it makes the folks that are viewing feel the same way. But I think, again, I'm getting back to the defined issues. It's our first responders, EMT, paramedics, that really work hand in glove with you and are doing the scoring, which is created by, usually it's the American College of Surgeons and the various agencies that are involved. But they make some very, very critical decisions based upon your educating of them. And I think it's just a wonderful, you know, you just spoke about the privilege of saving a life. I think it extends to them, to be very candid. That's the way I feel about it. So hats off to all the first responders that are involved. And I think that we're very fortunate here in South Florida to have the number of highly skilled, highly trained, and advocacy for life individuals that are in our trauma units. And it makes me proud to know that you're sitting across from me, and I'm looking at someone who does it all the time. And yet I'm a little jealous of the fact that you feel not much different than I do, but you have a different way of dealing with it. So it's really good to have you both here. And you, as a nurse professional, you made a choice which is pretty interesting, because it's tough. I know how tough it is. Again, I refer to the fact that I have a wife who was a nurse professional, but in her early part of her life, before she went into education and became the dean of a program, she was in a NICU situation, which in a sense is the beginning of life in an emergency, almost near trauma effect, you know, as far as emotion is concerned. So it's very interesting, and I thank you for for the privilege of you doing what you do. Just make sure you take care of all the docs and all the nurses.
Of course. The
doctors and all the nurses relative to what they do. Yeah, and again, I didn't mention it, but I want to mention it before we get off the air, that there is a very limited point of time between the occurrence of a trauma event and the opportunity for professionals like Dr. Nichiporenko to go to work with his professionals. It's called the golden hour because of usually blood loss or similar types of traumatic body injury, but that particularly blood loss. So, I mean, everything's got to be fast. It amazes me sometimes at the work that you all do.
We do a training with the community, and we're getting out to the schools called Stop the Bleed, and it's basically to teach people how to control hemorrhage, which in that case hemorrhage means bleeding, uncontrolled bleeding, because that's a lot of times people just need that little time to get to a trauma center, so that somebody like Dr. Nietzsche can.
We did a show on the new Stop the Bleed campaign, but it's an interesting thing. But we're down to the last 1 minute of the show, so I'm going to give you 15 seconds to say whatever you want.
I'll just thank you for having us here. I think it's important for the community to understand that prevention is definitely the best way to go, and if you can prevent a trauma injury, we'd be happy to come out to anybody's place of work, church, school, whatever. They can always call Broward Health North.
All right, we'll put the telephone number up to reach you.
So.
Dr. Nichiporenko, I'm getting a bit emotional because this whole trauma thing is really, it's in my heart. So thank you again, and you got your 15 seconds.
Sure, just thank you again for having us at your great show. But just want to let you know that everybody who works in trauma system in this beautiful state of Florida are very dedicated professionals, and we're very proud of the opportunity to serve to this community, because we're trying to be the best. When somebody comes in the middle of the night, I want to make sure that we have the best surgeons available for you, so you have the best outcome that you can have. And that's what our job is for, to save lives.
Again, on behalf of the viewers, the people that are sent to their homes, thank you both very much. Thank you, Broward Health North, a Level 2 trauma center, I believe. And I want to thank you for what you just said. Folks, I hope we gave you some information relative to the difference between a trauma unit and an emergency room. And remember, this is your show, so if you have any questions, you have any answers you want, there's a telephone number and an address here to reach us. This show is called Dateline Health. I always tell you to take good care of yourself. But in this case, I say take good care of you guys, because we need you. We come from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.